Hi, everyone, and welcome back to this week's Instagram Live. My name is Devin Trenkle, and I'm the clinical manager for Sinclair North America. And this week, we are having Jennifer Becker join us from Suvita Medical Aesthetics. We are going to be talking all things V-Series. So she's going to be discussing all about how the V-Series platform has been successful in her practice. And I'm just going to add her in. Okay, and Jen, I'm going to have you put in a request to join. These things normally take a second. Here we go. Hey,
Hi, how are you?
Jen, I'm doing well. How are you?
Doing great.
Good. Thank you so much for joining us.
Thank you for having me.
Yeah, of course. I mean, you've had such success in your practice with the V series. So I'd love to start off by discussing your journey towards aesthetics and, how you came about finding the V series and all of the different types of treatments you offer in your practice with it.
Okay, so how I came into aesthetics. Well, I've been a PA for 24 years, and just about like 8 years ago, 7 years ago, I had my first 20 units of Botox, and it made me feel so wonderful. So I wanted to give that feeling to other women. So really, that's how my interest in aesthetics started.
Mhm.
Fast forward to post-COVID, July of 2020, Suvita was born. And initially, we started as an injectable only practice, but I felt like I couldn't give my patients the optimal, full, like the best aesthetic outcome they possibly could have because, yeah, we were helping their volume loss, we were helping their rhytids, but we weren't addressing their skin. And we all know that skin glow gives you that youthful, bright, awake look. And that's what we all seek. We just want to be more refreshed. So I started looking for a laser. Honestly, I didn't know where to start. I felt really, really, truly overwhelmed, but I knew I wanted a multi-platform. I wanted to offer as many services as I possibly could. So we had a couple of reps come in and shout out to Cliff.
Hey, Clay.
So yeah, hey Cliff. So so Cliff came in and he was great. He wasn't pushy. He gave me lots of information, and I was really just impressed with the V series itself. I love all of the radio frequency capabilities that it has. I think RF is the fountain of youth, and
Right.
and honestly, like that's just I have zero regrets. Like I'm really all for combination treatments. So, I basically have just about everything now. I mean, I have the Pristine, I have the Dermafuse, I have the V30 with every handpiece, and we actually added in Energet, and we're doing great things with the Energet as well,
Love
as
it.
far as acne scar reversal, kinetic facelifts. But the more popular service here is what I call the laser facial. So the laser
Ooh.
facial, yeah, laser facial. So it's a combination of treatments that we put together that really addresses every skin concern.
Right.
And that's been really popular. I think proudly I have to say, of course, injectables is my most popular service,
Mhm.
but proudly my second most popular service is my laser services are my laser
Oh, I
services.
love
So
that.
it's really helped to bring in that for us, additional revenue, and my patients are just so happy with their results. They truly are.
I
And
love
that
that.
makes me happy when they're happy.
Of course. Of course, I know it's kind of a different side of healthcare. I know you started working in more of an urgent care setting. So, kind of going over into aesthetics, you're helping patients, but in a different way that's still just as rewarding. So, it's really nice.
Yeah, and sort of like starting out in the ER and working like you said, working mostly urgent care, primary care. I've even had some surgical experience, but I've always really enjoyed procedures. I really, really super enjoyed suturing, to be honest with you, but I didn't realize what I loved most about it
Mm.
was the aesthetic outcome. Like here I am putting this oftentimes mess, because plastics was not coming to the ER to fix the mess. Like
Right,
the PAs were there to fix the
right.
mess. So even before, venturing into injectables, like tons of experience with complex nerve blocks and complex facial lacerations. So I always enjoyed like just making something that maybe didn't look quite so beautiful and turn it into something beautiful.
Oh, I love
So,
that. Well, speaking of the fact that the V series is a multi-platform system,
mhm.
what would you say your favorite hand pieces are on the device itself?
That's
They're
really
all amazing.
unfair.
I know.
No, that's so
I'm like, I
unfair.
can't choose, but I have to ask
No.
you.
Oh gosh. So my workhorse is definitely the IPL. And like I said, as far as like those laser facials go, addressing reds, browns, overall skin texture and glow, definitely the IPL.
Right,
My second most favorite handpiece is the VST.
right.
So our second most popular treatment here is eye tight.
Love, love that.
Yeah, eye tight. So they're really getting a really refreshed look after a series of treatments.
Right.
um, in conjunction with, of course, they're injectables, but like all my patients, I've never had any complaints about eye tight, and they all come in for their maintenance treatments, and they really just love it. And I've even used it in I've had a few patients come in with really poorly overfilled tear troughs, like they didn't want to reverse, they didn't want to go for a bleph. So I'm like, we could try, like, just understand that we may not get even a 50% correction. And just the results have been outstanding. I would say my worst tear trough correction, well, was probably close to 70% improvement. And it was really, 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 really bad.
Wow.
Really overfilled. Yeah.
Right, right.
So she's very happy. And she comes in every 4 months for a maintenance.
Oh, I love that so much. And
Yeah.
for those of you tuning in who aren't familiar with the eye-tight procedure, so it's using our VST handpiece, which is bipolar radio frequency. And that radio frequency is responsible for stimulating collagen and elastin production. So when we use it in areas like the subbrow, above the brow, along the crow's feet, or even the tear troughs like Jen is talking about, we can help just kind of thicken the dermis and then lift the eyes as well. So it's a great alternative for somebody who's looking to kind of hold off on maybe an upper and lower bleph, or maybe as a complement to surgery, right? Because at the end of the day, nothing is permanent. So we reset the clock with surgery, and maintaining your investment is super important. So I love eye tight as well. I think it's a game changer. I also love that you get a little bit of instant gratification with it. So if somebody has
Mm-hmm.
an event to go to, you get that nice little Cinderella effect and eye lifting, and it's just a game changer. So totally agree with you on that. And then to get to your point with IPL, it is a workhorse. The reason why it's a workhorse is because we have all these different filters, these different wavelengths we can work with that treat so many different things. So if you have a patient who comes in and they have hyperpigmentation, perfect, we can take care of that. But let's say they also have vessels, right? Those little stubborn vessels we get around the nose. We can work on those too. So it's really just a workhorse in the sense that it works on so many different things to improve the complexion of patients.
Exactly. And actually today I've treated a couple of patients with acne, of course, with the IPL handpiece, but not only IPL, just using a combination of the other treatments I have available here and just packaging everything together.
Hmm.
And she's just been so successful with it. So now we're on to phase two. Her
Oh,
acne isn't angry anymore.
right.
So now we're moved on to phase two. We're going to work on her post-inflammatory erythema, her post-inflammatory hyperpigmentation. But with treating the acne with the IPL handpiece, we've also seen an improvement in her overall glow and skin texture. Her skin texture, her acne scarring is to a bare minimum, I have to be honest with you. I mean, it wasn't terrible to begin
Right.
with, and I'm not necessarily saying that IPL is the best treatment for acne scarring,
Mm.
but this really was an added benefit in getting improvement in her skin texture. So now what are we going to do? We're going to move on to the next step, right? We'll resurface.
Right.
We'll
Absolutely.
we'll we'll add some Energet,
Right there.
you
There
know.
you go. I love
Let's
it.
some use some Energet and get,
Yes,
pop out those scars
absolutely.
and resurface.
Absolutely. I think that is the future, because I mean, with our Energet, again, for those tuning in, it's separate than the V Series platform we have, but it's a pneumatic needle free jet delivery system, and it allows us to deliver different therapeutic compounds into the skin. In the case for acne scars, we take a dilute HA, and then it helps perform a liquid subcision and simultaneously also helps build up collagen to reduce the appearance of the depressions. And acne scars are the hardest thing to treat, right? Especially the ice pick scars. They're just so deep, and it's just a very, very stubborn thing to treat. So I think that's an absolute game changer. Once that step's complete, yeah, I mean, ablate, right? We can
Hmm.
absolutely resurface with some fractional technology, which is on our V Series platform. So with that being said, it sounds like you do utilize combination therapies in your practice, which I think is an absolute game changer for your patients, then also for you as a practice, right? For your ROI.
Absolutely.
Yeah.
Yeah, because there isn't only one solution. Like Botox, and I use that as a blanket statement, it's not the only solution.
Right.
You really have to put the work in, and combination treatments are really what we do here. And we're really for regenerative treatments. Of course, we want the body to heal itself. We want the body to produce its own collagen. And I have to tell you, girl, the VVR is
Yeah. How are you liking it?
my new favorite.
Yay!
Hello. Yeah, I told you, like, we could talk here for hours about
I know.
the radio frequency capabilities on my V30. I said, she's my girl. I'm like, here she is. My V30 is my best friend. So yeah, so with the VVR, it is new to us here at Suvito. We have expanded our services. We are doing sexual wellness here now, which I'm super excited about. But we've done a couple of treatments, and even after only one treatment, a couple of weeks later, like tears of joy. I,
Hmm.
I I'm just so thrilled. Honestly, like we really truly are making a difference in
Right.
patients'
Right.
lives. You know, you restore their confidence, they're able to get back out there into the world with their newfound confidence or reborn confidence and just do it, just live their lives.
Right. I totally agree with you. And I feel like with the VVR, I mean, we're addressing stress urinary incontinence, laxity, lubrication, all things that kind of happen as we age and we start to lose estrogen. And that can be an absolute game changer for somebody because stress urinary incontinence, I mean, it really affects your activities of daily living, like just something as simple as a workout, and you have to second guess, oh, shoot, should I run to the restroom before I do this workout? Or I'm going for a run or something like that. Anything that involves jumping, or I have to sneeze. I mean, we hear these stories over and over again, and I think it's something that should be more openly talked about because it's not, but it affects so many women. And I think that the fact that we have this wonderful handpiece that can address these issues and concerns is amazing.
It really is. It's truly amazing. And like we have opened the conversation. So like more and more patients are getting more and more comfortable with talking to us about it. And the reason why we brought it to the practice is because we're a little family here. So the patients, we love them, they love us, they're comfortable, they trust us. So they open up to us and we just want to help them in any way we can. So yeah, so we're super excited to have added our final handpiece to the V30 platform.
Love
Yeah.
it. I love it. And, another point to bring up is the fact that the VVR handpiece didn't exist, initially when you had your V30. So I think it's important to note that every time, new handpieces come out, it can be compatible with the V series, which is nice. So as your practice grows, we grow with you.
Yeah, no, for sure, for
Yeah,
sure. We
absolutely.
love our V30. That is a definite.
Yeah, absolutely. Well, what other treatments do you find to be super popular? I mean, you said eye tight's popular. You address acne scars. IPL is your workhorse. Gosh, what about V form?
V form, so V form I actually do love. I love V form for treatment of cellulite. Unfortunately, I'm not getting anyone's consent to before and afters for that.
Right.
I wish I actually
Mhm.
did, but it's a little personal and people are a little self-conscious about it, but we're getting incredible results. And what I love about the V form and even all the other like radio frequency capabilities of the V30, there is no downtime.
Right.
Even like let's use VFR for an example where you're actually ablating the skin,
Mm.
you're basically healed up in 7 to 10 days.
Right.
I'll add PRF that's
Uh,
rich in growth factors, and I'll send them home with some nectar and like in 5 to 7 days they're already all healed up.
right. Night
So it's
downtime
it's
is
all
queen.
about no downtime, minimal downtime for the patients. They absolutely love that. And we also have a skin club here. We have an express skin club that we've launched that's been really a
Mhm.
hit. So we're using a combination of treatments with the skin club, including, of course, our microdermabrasion, our dermal infusion, and also they do get a savings on IPL photofacials. And yeah, that's been a hit because no, they don't want to come here for an hour and just like, kind of get their face rubbed. They just want to come. We're very busy, we're working women. We want to just like
Right,
get down to business and
right,
then get to it, go back home and do what we have to do. Take
right.
care of the kids, cook dinner. Gosh.
Yeah, I know. It's amazing, right? We do all things.
All things. And also, anyone that knows us knows Sam. Shout out to Sam. She's the
Oh,
aesthetic coordinator manager here. She's like, Jen, we have to like, we're by the Jersey Shore. Like, we have to figure out a laser hair removal membership. So we've been back and forth with it. So to come up with a really cool membership that we're going to launch probably by the end of this week.
oh my
We're
gosh. Is it going to
putting the
be
final touches on it.
something from the Jersey Shore, like gym tan laundry? For any Jersey Shore fans out
Oh,
there? That was my
gym hair
generation.
removal laundry.
There
Yeah,
you
I mean, you
go.
could,
I like
there you
that.
go. Little fist pumping
Yeah, there you go. I love
action.
it. A little techno music in there.
All right, Devin, when are you coming? Let's go.
Let's do it. I'm
Let's
down.
do it.
I think you brought up a good point about downtime. That's like the number one question that gets asked. And, when I was working for a plastic surgeon out in California, it was during COVID, the height of COVID, and there was a big uptick on people coming in. And it was because of the fact that nobody could see other people. You would go get your
Hmm.
treatments and then you would go home and you were wearing a mask if you were outside or around other people. So we saw like this massive influx of people who came in, not only for the surgical options, but for the non-surgical treatments as well. And I feel like it's still a question that's asked, well, hey, how much downtime is there? So the beauty of the device is, you're right, that there really isn't much downtime. And even with the VFR, the fractional handpiece, I mean, it's kind of one of a kind in that sense, because the fractional technology just minimizes downtime because we're not fully ablating the tissue. So, and you can customize treatments as well. So if a patient came in one week and they're like, hey, yeah, like you can totally like fry my face off today. I'm cool with it. I'm not doing anything for a couple days. Awesome. But maybe next month they come in, hey, I don't know, like maybe we can focus more on my laxity this week. That was also a concern of mine. Now we know we can kind of adjust our settings, focus more deep in the skin, and give the patient a little less downtime. So we work with the patient, which is great.
And again, it's needleless. For me, it's a no-brainer. Why would I want to sit there for, a microneedling procedure that is painful
Right.
versus a procedure that is needleless? It's very, very comfortable. You could use a little BLT, but I think for the most part, you don't even need the topical anesthesia.
Right.
It's very well tolerated.
Right. I agree with you. I think it's almost every time I've done a treatment on somebody, it's almost been, oh, like that's what it feels like. That's totally fine. It's comfortable. And I'm like, see, there you go. And it gives great results too.
Great results. And we've even had, I'm getting excited about talking about RF. I love RF.
I know,
It's
me
my
too.
okay, aside from Botox, RF
Yes.
is just my favorite.
Mhm.
So we've had huge success even with the V-Slim protocol. What is that? What's the V-Slim? We are actually improving lower face jowling, right?
Mhm.
Because the only thing that'll lift is a facelift or threads or a kinetic facelift. We
Right.
can't forget the Energet, and the Energet has been a game changer because like people are afraid of threads. Even though I try to give them reassurance, hey, I numb you up, you're not going to feel anything. For them, they're still nervous about it. But with the kinetic facelift, on a scale
Right.
of 1 to 10, honestly, it's like a one, maybe a one. Like it looks scary because you
Right.
do get those dermal
Right.
papules that look like mosquito
Right.
bites, but the patients are just totally comfortable. And even with that, no downtime.
Yeah.
But V-Slim has been amazing because you are slimming the lower part of the face and you're also tightening the skin.
Mm.
So, and like the treatments get better and better. Like the patients, like, it's almost like they don't believe you at first that this is going to get better and better. And then, I see them pretty regularly and then they come and they're like, I just woke up one morning and I'm like, wow, is it my imagination? I'm like, no, it's
Right.
not. Your body did its thing. It's created its own collagen. No, you look great. They look
Right.
great.
Oh, I love that so much. And remind me, do you offer weight loss services in your
We
practice as
do.
well?
Yeah, we do now.
Perfect. Do you
Hmm.
feel like that's been a nice compliment or should I say, do you feel that radio frequency has been a nice compliment for those patients who have lost a lot of weight, who have laxity, sagging, jowl?
Yes. So definitely that's been a really great compliment because we're doing.
Sorry, guys, we're back again. We just had some technical difficulties there. So I'm going to add Jen in again. It'll just take 1 second. There you
Hi.
are. Hey.
I thought I did something wrong.
Me too. I thought I offended you and you just hung up
No,
on
no,
me. No.
no, no, not at all. Not at all.
Yes. Sorry about that, everybody, but we're back. So sorry, you got cut off. So we
No,
could
so
pick
in
those back up.
talking about like, supportive treatments for, skin laxity and weight loss.
Mhm.
Sorry. Um, yeah, so definitely the radiofrequency handpieces have been helpful in tightening skin. But another really super helpful treatment option has also been I know we're here talking about the V30, but how can we not talk about
I
the
know.
Energet? Like, yeah, those kinetic facelifts have been really, truly amazing, as well.
I love it so much. And again, the Energet is a device that allows us to pneumatically deliver different therapeutic compounds and medications to the skin. So there's really, I mean, it's one of the most studied devices that we have in our repertoire of technology. It was over in Europe for, gosh, I think about 12 years. So I love that. I think using or combining evidence-based practice and yielding great outcomes for your patients is amazing. So I'm glad you're getting such success with it. Have you been using it for acne scars at all?
I actually do have a patient that was a little leery
Mm.
again because to them it is a new treatment, and I
Right.
believe I don't know if we still are the only ones in South Jersey that actually have the device. So whenever a new treatment is available, patients are just a little cautious about it. So we only did one treatment.
Right.
And, initially you do get that fill effect from the
Right.
HA. You're hyperdiluting HA, it gets injected into the skin, into nanoparticles, so you are subsiding those
Mhm.
scars. And then the volume of the solution is basically replacing that void.
Right.
So you do get an immediate improvement, but patient wasn't so convinced after one treatment. I said, well, you do kind of need up to three. She goes, no, I'll wait, no, I'll wait.
Right.
It's probably been about 2 months, and she looks absolutely amazing.
Right.
She has a huge improvement only after one
Mhm.
treatment, and her results actually are posted on our
I
Instagram, her before and
love
afters.
that.
Yeah, she
Yay.
looks absolutely amazing. And when she first started coming here, she was full on, like full coverage foundation,
Mhm.
and now she hardly wears anything at all. She's super proud of her skin.
Oh,
And again, that makes me feel so great that she feels great. Selfishly, right?
right.
I'm being selfish, getting that like warm and fuzzy feeling that my patients are happy.
Yeah, no, I love that. Again, it's such a game changer because it can make somebody self-conscious. I love that we have something, available for patients like that. And I think it's important to note too, when we talk about acne scars, I mean, the other treatment modalities out there are, maybe using some type of peel, using ablative devices, and then using this. I just think it's a game changer because, I mean, who wants to have a subcision, right? Subcision's another alternative and it's kind of
Hmm.
uncomfortable. And I remember when Dr. Carniel was speaking at our last Beauty Boss event that we had in Dallas, he mentioned that, you don't just have like one atrophic scar on the face. So when he would be performing these liquid subcisions, it was almost like he was doing 30 little micro surgical procedures to
Yeah.
someone's face. He'd have to continuously numb them to make sure they were comfortable, and it was a whole process. So I think the fact that we can quickly control the depth of penetration and the amount of product we're putting in the tissue to help get a good outcome comfortably for the patient is an absolute game changer.
Yeah, no, definitely.
Yeah.
And we have a full repertoire of treatments here. Like I actually offer, I can't think of anything I don't offer, honestly. But
You're a
I'm
one-stop
like,
shop.
so I'm like, okay, so we have the VVR handpiece, like we're addressing female, you know, um, sexual health issues. I'm like, what else could we do? Are there any RF capabilities to help improve any outcome for men? I don't know. We'll see.
Right. Right. Absolutely. Yeah. To be determined for sure.
Hmm.
Um, Have you gotten success with the YAG laser, the
So I
1064?
have to be honest with you, that's my
Yeah.
least
Yeah.
used handpiece. I'll use it, because I'm very conservative with darker skin types. So I'll
Right.
use it for hair
Hmm.
removal in smaller areas
Right.
in a darker skin type.
Right.
And also I'll use it for just like small little
Right.
vessels, spider hemangiomas. I have used it successfully with that, but it's my least used
Yeah.
handpiece. It just worked out that way. But it's there, because for the vessels, like let's use like the IPL for example. Let's say we have some vessels that are a little bit more dilated
Mhm.
that are being a little resistant to IPL.
Right.
I'll just hit them with a YAG and they'll disappear.
Exactly.
Mm-hmm.
That's what I would say. Like start off with like a more shallow wavelength with IPL, and for those stubborn guys, it takes a couple of times, and you're like, man, like maybe we can try something a little bit deeper. Then I would go with the YAG for sure. And I think it's great that you have the multi-platform system for a patient who's a Fitzpatrick 5 or 6 that walks into your office looking for hair removal. I mean, the longer the wavelength, the safer it is for darker skin types. So it's amazing that you
Mm-hmm.
have the ability to treat everywhere from Fitzpatrick 1 all the way to a Fitzpatrick 6 with the technologies.
Yeah, and honestly, whenever I have any kind of sort of question, you guys are available. I
Yeah.
like that. I like that you guys are sort of like still, even though you've merged with Sinclair, you're still very much like again, like a small little family,
Mm,
because we
absolutely.
thrive on that as a practice, and our patients thrive on that, and that's sort of what I'm used
Right.
to.
Right.
So I am so happy that we haven't, as a practice, slipped through the little cracks of Sinclair once you guys merged.
Right. I love that so much. And I have my own experiences with that too. I mean, before I became an employee with Sinclair, we used the V Series technology in the practice I worked for. And I have to say the training that I had personally is what prompted me to kind of begin my own journey working as a clinical trainer. So I can't thank Sinclair enough for that. And I just feel we have such a strong clinical team, clinical department as a whole. I mean, our CEO is an esthetician as well, and she's got a strong clinical foundation, and it really sets the tone for the rest of the company. So I think that's why we're so heavily invested in making sure that you not only understand how our technologies work, but the foundational principles behind why they work. And that was huge for me. Like I knew how the devices all worked, but I think as healthcare providers, we always want to know the but why and how, you know?
Right.
Yeah.
The why
So
and
that's been great.
the how is super
Yeah.
important. Yep. And just having like just you guys having our back, right? We're from New
Hmm.
Jersey. You have our back.
Yes.
So just knowing and understanding that is really wonderful.
Right.
I think, geez, maybe it was last year. Uh, I I needed one of my handpieces serviced. They're like, oh, Jen, no problem. We'll overnight a new handpiece to you. I'm not even kidding. That morning, the very next morning, in front of my home doorstep was the handpiece. Like I was never more grateful. Like just like little things like that, honestly. They make a huge impact.
We have to
You
shout
know,
out the customer care team on that one. Shout out to
shout
Aaron,
out to everyone. Aaron,
Jane,
Aaron,
David,
I've never
Kevin.
met you before, but we've
Yes,
spoken plenty of
yes,
times.
absolutely.
Yeah.
They're all wonderful. And like you said, it's a family for sure. So I guess before we pop off, I just wanted you to kind of provide any advice for somebody who's looking to invest in something like the V Series, a multi-platform.
Okay, it's definitely worth it. It's worth it as far as like, just bringing in additional revenue as a practice, and you will be able to have a full menu of services for your patients, and you'll be able to give them an ideal aesthetic outcome without the downtime. And of
Right, right, absolutely.
course, you have the backing of a wonderful clinical team at Sinclair. So it's a no-brainer. For us,
Well,
it
thank
was a
you.
no-brainer.
Thank you so much. We appreciate that. We appreciate you in all of our accounts. So with that being said, I'm going to have us pop off, but just a friendly reminder, I will be popping on to Instagram Live again at 6 p.m. Eastern Standard. So feel free to hop on again and learn a little bit more about our Dental Beauty Boss coming up.
Yeah,
Thank you
really
so much,
cool. I'll
Jen.
be there.
Yeah.